Good evening, everyone. I'm Antoinette Biordi. Thanks for joining us. An illness with possible links to COVID-19 has now killed 2 children and a teenager here in New York. And as the state works to learn more about the illness, more than 70 other cases are currently being investigated. News 12's Carol Wilkinson has more.
The deaths of 3 children in New York shedding a new and tragic light on the pandemic. Among the young victims, a 7-year-old boy who died this week at Maria Ferreri Children's Hospital in Valhalla, a teenager on Long Island, and 5-year-old Christopher Henderson of the Bronx.
He didn't, get to experience life. He didn't even get to, go to first grade.
Wound up having developing a blood clot in his brain. A few days later, he was pronounced brain dead. Right there, there is no coming back from that.
Governor Andrew Cuomo says 73 children statewide are showing symptoms of this mysterious illness, possibly linked to COVID-19.
These are children who come in who don't present the symptoms that we normally are familiar with COVID. It's not a respiratory illness. It's more an inflammation of the blood vessels, which can then cause problems with their heart.
Rockland County pediatrician Dr. Janice Montague says while researchers work feverishly to find a coronavirus vaccine, she and her fellow doctors will continue to fight with the weapons they have.
After we get some lab work, they are seen in first step by a cardiologist, and the cardiologist does an echo of their heart and looks for the arteries that feed the heart are called the coronary arteries. And if there's inflammation there, we want to know. But most kids, either way, whether there's inflammation there or not, they can develop inflammation even weeks later. We treat them with 2 things. We treat them with baby aspirin, which is anti-inflammatory, and we treat them with something called intravenous gamma globulin.
At the request of the CDC, the state is helping develop national criteria for identifying and responding to the coronavirus-related illness. And physicians are cautioning parents to seek immediate medical help if their children exhibit signs of fever, rash, trouble breathing, or abdominal pain. In Valhalla, Carol Wilkinson, News 12.
Thank you, Carol. And similar cases of the syndrome in children have been reported in Seattle, Northern California, the United